Gareth Davies.
Thank you, Madam Chair. I rise to speak on behalf of the official opposition to Amendments 13 to 18 and New Clause 1, which stand in my name. But first, I think it is important, I'm afraid, to just remember the context of the situation that we find ourselves in today. Throughout the election, the Chancellor and the Prime Minister promised the British people they would not raise taxes on working people. Right. They committed specifically to not raising national insurance. But here we are, committee stage, debating a national insurance tax on working people worth some £25 billion. Each and every single member opposite made specific promises to their electorates on national insurance, to their constituents, a promise they have now broken. We have it here in black and white. Clause 1 raises the rate of secondary class national insurance from 13.8% to 15%. And to compound the impact, Clause 2 drastically cuts the secondary threshold from £9,100 to £5,000. This two-pronged attack on business means that while Clause 1 squeezes more from businesses, Clause 2 simultaneously pushes more businesses into the taxman's grasp. Taken together, based on the data from HMRC, a staggering 940,000 employers are set to lose out in net terms from this bill. The OBR has made it clear that each one will be hit by an average of £26,000 in additional tax. At second reading, we heard the same old script from the party opposite and the members on the backbenches. Time and time again, we hear that this bill will only hurt the largest businesses, but this is not correct. I will in a second. Most high street hair salons wouldn't say that they are a big business with mounds of profits to give away to the Exchequer, no matter how much hair mousse this Prime Minister buys from them. A village family butcher surely wouldn't regard themselves as profiteering fat cats, and community pharmacies providing vital services to residents young and old surely can't be put in the same category as a large multinational pharmaceuticals company, and yet they are.
Thank you, Madam Chair. The honourable gentleman's making a very eloquent argument against increasing the employer's part of national insurance contributions, and yet the honourable gentleman himself voted for the health and social care levy, which was an increase of greater proportion on both employees and employers. I've just checked his Hansard. He made none of the arguments he now progresses today when his side was putting that through. So can I ask him why his mind has been changed now he's in opposition?
I find it really difficult, Madam Chair, that on the one hand, the Labour Party say that we are irresponsible with public finances, and yet when we faced a once-in-a-century pandemic and spent £500 billion to support residents and businesses and families in Stoke and across the country, we decided we needed to pay that money back. We decided we didn't want to keep debt rising. And so, yes, we made difficult decisions in the face of a global pandemic. There is no global pandemic today, Madam Chair. This is a political choice, and that is the difference that we find ourselves in today. And I'll give way.
Thank you. Thank you, Chair. And you've been very kind at giving me again so quickly. Sorry, the honourable gentleman has been very kind. Thank you. So the point was made about the billions of pounds which were spent during the pandemic. Can the honourable gentleman outline how much of that went to Tory party mates and donors through dodgy contracts?
Madam Chair, I know he wasn't here for this, but actually those of us who were in Parliament faced an incredibly challenging time in very difficult circumstances, and billions of pounds went to support businesses in his constituency. And I think if he has a conversation with the average business who benefited from the furlough scheme, he will correct the record on that. But let me move on. The problem that we have here, Madam Chair, is that fundamentally, socialists just don't understand or care what it means to have an idea, to take a risk, to work hard day in, day out, to make their business a reality. That's the problem. They think it's all so easy that profits just flow in, and it's all going to be all right. The government can step in and take as much tax as they want. It's not the case. Talk to the average business in your constituency, and you will find this out. Set up a business and you will see for yourself. But perhaps most worrying of all, not only do they not understand the private sector, they have completely overlooked the different ways in which the public sector provides for our communities, just as my honourable friend was setting out. Whether healthcare, childcare, or the charity sector, organisation after organisation have warned ministers that this tax rise will impact the services that they provide. Now, this may not have been intended, but the government still has yet to act. That's why we've had to table Amendments 13, 14 and 15, and Amendments 16, 17 and 18, which seek to protect certain key sectors from both parts of this tax in both Great Britain and Northern Ireland, respectively.
The Minister has hit the nail on the head, and the Treasury really need to answer the question. Did they knowingly implement these tax rises on these industries, which is a travesty in itself? Or did they do it by mistake because they don't understand these issues? And if that's the case, will they look to rectify it to make sure that the hospices, GPs and childcare are protected?
Well, I thank my honourable friend. I couldn't have put it better myself, actually. I think these amendments highlight, actually, that Labour's attempt to paint this tax rise as a necessity for public services is nothing but plain politics. They'd always intended to do this, and now they're hiding behind public services to be able to justify it. We know that those on the front line of healthcare working alongside the NHS will be deeply impacted. The Institute of General Practice Management estimates the tax bill of each GP surgery will increase by £20,000 a year, likely resulting in a reduced number of appointments. In the adult social care sector, the Nuffield Trust say that care providers will face a £940 million increase, dwarfing the social care support announced at the budget. Community Pharmacy England say that community pharmacies will be hit by an additional £50 million each year, inevitably causing pharmacies to close and services to deteriorate. And Hospice UK warns that £30 million will be added to the bill for 200 hospices across the country, and it will lead to greater pressure on NHS palliative services.
My honourable friend is a fellow Lincolnshire MP. He knows that we have St Barnabas Hospice in Lincoln, which is a greatly loved local institution where most people, if they have to spend their final days anyway, want to go there. We have the Lincolnshire Air Ambulance. Yep. We have GPs all over our huge county struggling. Can he explain to me how it is in the public interest to attack these people?
Well, my right honourable friend, the Father of the House, my colleague from Lincolnshire, puts it perfectly. Why on earth, if you stand up and say you support public services and that public services are apparently being trashed, why then go and tax them? Why then add to their cost base, which they have said very clearly will reduce services in each of their constituencies? And they're all going to walk through the lobbies tonight and add to the cost burden of those services. It doesn't make sense. And I will in a second. And charities have also signalled the alarm, by the way. Over 7,000 charities wrote to the Chancellor warning of the £1.4 billion hit that they're going to face just next year.
I'm grateful to my honourable friend. Would he agree with me that the colleagues opposite on the back benches need to speak to their ministers? Because, as my honourable friend suggested, they cannot have meant to do this deliberately. So whether they accept our amendments today or via some of the funds, the 22 or 25 billion, whatever it is, into the NHS, across to this, because the NHS depends on social care and other services, and at the moment they risk taking something which could be a triumph for them and turning it into a disaster both for the NHS and, more importantly, for patients and those most in need.
And again, makes a very valid point. I actually, and as I said already in this speech, I'm not sure this was intended. I don't think they understand what this is going to do to our communities, to these sectors that I've outlined, and to the businesses that I will come on to speak about in a minute. But the Minister will have to address his point. What are they going to do about this impact? What are they going to do to mitigate the damage of this bill to those communities, to those organisations that I've highlighted? One I haven't highlighted yet is also the childcare sector, without which millions of parents across this country could not go to work without, including, by the way, many in this House. But this bill will contribute £47,000 in additional costs, on average, per nursery next year, according to the National Day Nurseries Association. The previous government did so much to extend childcare to more families, boosting workforce participation and economic growth, but this tax hike will now pull us back from that progress. This is not what people voted for. There is no mandate for this harm. I would urge the government to think again. Now, of course, ideally all employers would be made exempt. That's why we, on this side, voted against this bill. At this time of year, people should be reflecting on another year gone by all too soon and looking to the new year with hope, ambition and optimism. But so many employers are now going to enter 2025 with fear. Many will be thinking again about that planned expansion or new investment in new equipment or premises. Worse, some will be thinking about who they need to let go, never mind awarding the pay rises in the spring that they once hoped to give.
Very grateful to the Minister giving way. And he made, well, I know he's an astute man, and he's picked up on something that I more fear, is that the S&P Global Purchasing Managers Index has said this has been the third consecutive month of job losses. And December's been the greatest since 2021 in the pandemic. And they go on to quote, barring the pandemic, the survey has not seen job losses on this scale since the global financial crisis in 2009. That is a direct impact of the choice of the budget and this NIC increase. Does he agree with me? This is something that really needs to be thought about by the government.
I completely agree again with my honourable friend, who again has made a very astute intervention, because it marries very clearly with what we've seen in business confidence. He mentioned the record since the pandemic. Business confidence has tanked to low levels that we've not seen since the economy had to be shut down during the pandemic. And actually, if he looks at the CBI survey, that made for start reading too. 62% of businesses said that they're going to reduce recruitment. 48% said they'll be reducing existing staff levels. All because this bill, before us today, is going to impact them in ways that they never imagined, in ways that they were never told about. Whether businesses just freeze or cut, or as the Chartered Institute for Taxation have warned, they shift employees to a self-employed basis, or they, even worse, offshore workers to overseas destinations. The potential impact on employment should absolutely worry us all. That's why we've tabled New Clause 1, which would require the Chancellor to publish an assessment on the impact of this tax rise of the employment rate within a year of the passage of this Act. It's not controversial, it just seeks clarification and assessment.
I'm very grateful to my honourable friend. I do think this impact assessment is extremely important, not least because at a macro level, given that the UK is essentially a services-based economy in which the human capital is the most expensive, effectively fixed cost, there is no way to escape this tax. And unlike corporation tax, which is levied on profits, this tax is levied whether you're making a profit or not. So businesses which have been marginal but struggling may well be forced into a loss and therefore may choose to close down. It has to be essential, doesn't it, that we look backwards if this tax goes ahead and say what has been the impact on us from a services point of view.
That was a classic case of how you do an intervention, Madam Chair, because that added to the debate. I hadn't mentioned that, and he's absolutely right about that point. The impact on employers who will pay this, whether they're profitable or not, is absolutely right, and something, again, I don't think the government have fully appreciated. But we also know that the hit to employment is not the only consequence of this bill. That's why New Clause 1 focuses on other factors in the economy, such as real wages, inflation, and real household disposable income. The OBR have made clear that by 2027, 76% of this tax will be passed on to working people through lower wages and higher prices. They also estimate that inflation having gone through all that pain to get it down to target 2%, will be higher, and it's already on the way up. And because this policy is fundamentally regressive, it will hit the worst off the most. Madam Chair, this surely wasn't intended. And so let me say and conclude that I will repeat what I said earlier. This is not what people voted for. There is no mandate for this harm. I would urge the government to think again, and they can start by backing our amendments to at least mitigate some of the impact of this damaging bill.